Joining us to talk about this now, as well as to talk about what's going on between the administration and China, is Senator Mark Warner from Virginia. He's proposed, along with other senators, the Paycheck Security Act to cover wages and benefits lost by employees across fields affected by COVID-19. Senator Warner, thank you for joining.
My pleasure.
A lot of people haven't even managed to get unemployment insurance into their hands yet, and it's already the time to start panicking about July when those benefits run out. What's your priority right now? What needs to be fixed immediately?
Well, I believe with 36 million Americans now unemployed, with literally 40% of folks who make $40,000 or less having lost their jobs. And as we know, in the American system, oftentimes when you lose your job, you lose your health care as well. So we've seen a spike of about 25 million additional Americans losing their health insurance. I think it's a moment to say, take a pause, and before we simply refill the unemployment bucket or refill the PPP program, which now has had over $600 billion invested in it, that maybe we should look, is there a different, more efficient way to deliver direct assistance to Americans who are most in need? So I'll be introducing later today something called the Paycheck Security Act, and it kind of ranges in the Democratic Party from Bernie Sanders to Doug Jones, kind of spans the whole breadth of ideological spread of the Democratic Party. And in many ways, it's modeled more after the European models, where the governments there have provided direct support to paychecks of workers who've been laid off. We provide a very generous 100% of a paycheck up to $90,000 a year. We include overhead spending as well. This delivery mechanism, I think, would be more efficient. It also, in the state so far, we've focused a lot of our attention on small businesses and airlines. We've done nothing for the middle market firms. So this Paycheck Security Act would go from the micro business all the way up to large firms in terms of reconnecting those furloughed workers with their employers. That would reconnect them with health insurance, would allow people to be brought back quicker. And when you actually run the numbers, if you decrease the amount of expanded unemployment, decrease the amount on Medicaid, not have to refill PPP, the costs are about the same. This proposal has been endorsed by as varying groups as the Wall Street Journal and the New York Times, and we know they don't agree on much, and there are Republican colleagues who've got similar proposals. So we're saying, let's pause, let's think about this delivery mechanism. We'd use the employee retention tax credit in a refundable form, so there's already a system set up with the IRS. And I actually think it may have a chance to be a new approach.